What is rehab or rehabilitation? My name is Fred Bagares, a board-certified sports and spine medicine physician in Virginia Beach, Virginia. After 10 years of practice, I still find musculoskeletal medicine both fascinating and challenging. This podcast is about the lingering thoughts and questions I've had after residency and fellowship. My hope is to spark discussion, challenge dogma, and share my experiences in musculoskeletal medicine. Welcome to the Talking Rehab Podcast. All right, here we go. This is actually a really very important topic. It's something that I run across every day in clinic, and that is describing what exactly is exercise and what is its role in rehabilitation. Again, as a musculoskeletal practitioner, I see people at various phases of injury. So during the acute phase, and even with the chronic and preventative phases. So it's a very common question that I get about, I don't really understand what I'm doing. What is this exercise going to do for me? Why am I being referred to physical therapy? I can lift weights and, I can bench 250 and I can squat 400 or whatever example. It is a difficult topic sometimes to answer. And, as a younger practitioner, I didn't really have a great answer for it. I just kind of told patients, obviously, despite you being as strong as you are, here we are. This is an injury that you have, so I have to send you to this place to work on things, and that's that. And I just kind of accepted it for what it was. Now, as an osteopathic physician, I do think that there's obviously therapeutic value to therapy, but it can be challenging to explain that to somebody that is really just has one goal in mind, which is to have no pain and get back to their previous level of activity. So over the years, I've started kind of thinking about it as in terms of a framework of how am I going to explain this to a patient. And then I really had to kind of take a step back and say, well, how are you actually going to explain this to yourself? Because, exercise is kind of a very nebulous term. I looked it up in the Bradham textbook, which defines exercise as bodily exertion for the sake of training or improvement of health. And the definition of therapeutic is the treatment of disease or physical disorder. And again, these are words, they give some context, but still fairly vague when you're trying to explain to someone you need therapeutic exercise. So this is kind of how I view or categorize exercise in my mind. There's really kind of three different categories. There's therapeutic, there's goal-based, and then there's recreational. So therapeutic for me is really focusing on the injured structure. So meaning you have knee pain related to a medial collateral ligament sprain or strain or, underlying arthritis. So as a result, there may be some soft tissue swelling, edema, loss of range of motion, and obviously there's pain and some instability. So therapeutic exercise, at least in my practice, is usually in the realm of physical therapy. And that's where I typically will refer people to start. The goals of therapeutic exercise is to really try and help control the pain symptoms while minimizing any secondary effects of being less active as a result of the injury. Meaning that when someone injures their knee, they take on a different walking pattern, so they end up developing contractures sometimes in other areas, maybe not even just the leg that's injured, but the contralateral leg. People can develop atrophy of the muscles, and the neural firing patterns can also be off. So those are some of the things that I expect a therapeutic exercise program to help with. Now, the other things to consider is that from a cellular level, exercising the injured structure actually can trigger regenerative capacity or regenerative processes of the body. So while it doesn't always make sense to the patient, it's still hurting or it's not changing, the act of actually doing it does trigger the body to stimulate healing of that general area. And we do have to kind of remind our patients of that, because I think they tend to be more focused on the long-term goal versus the short-term goal. And that can be very, very difficult for people to accept because, particularly for someone who's very physically active at a very high level, they're doing some very basic exercises and experiencing pain. It can be very difficult for them to actually see how is this exercise going to get me back to that. So that once people get past the therapeutic phase of things, I start to look at more of the goal-based. So goal-based, again, I will subdivide it into skill acquisition, muscle hypertrophy, improving cardiovascular health. So skill acquisition for me is jumping, landing, floor transfers, working on balance in particular, just some general examples of skills. And, that's definitely different because from a therapeutic standpoint, you're usually focusing on one particular body part, but now you're actually trying to learn or relearn skills that will help you get back to your previous level of activity and maybe even prevent the chain of events that led to your injury. The improving cardiovascular health, I think, is typically achieved with people running or swimming, something where they can actually increase their heart rate to the point where they're drenched in sweat. And again, I think this is where patients can sometimes not really see the whole point of these therapeutic exercises or working PT because they are not drenched in sweat and their heart rate is not through the roof kind of a thing. Some folks just really don't really characterize anything. They don't really see exercise as being something where you're not really huffing and puffing or just completely exhausted. But there has to be some value in this type of exercise. Now, improving cardiovascular health can be done in a number of different ways. Obviously, running, swimming, biking, stair climbers, walking, that sort of thing. But I kind of take it a step back from there. When people become very deconditioned from inactivity or injury, their cardiovascular health kind of plummets. And as a result, we do know that people who have very poor cardiac health and poor exercise intolerance, they generally have higher levels of pain. So it is a goal for me to get people to start actually getting their heart rate up, even though that they have pain. And the goal is really to get your heart rate up with a tolerable level, because that's really the only way to get to the point that they want to get to, which is drenched in sweat, heart rate over 140, 150, that sort of thing. It has to start somewhere. I wish I could say that, we can just make the pain go away completely and you can just go back to just your previous level, but it just doesn't really work that way. The last goal is kind of the more obvious goal, which is, kind of muscle hypertrophy, working out the bigger muscles. And again, I don't usually have people work on this particular goal until they have good skills and they've actually gotten past the therapeutic phase. I do see people do therapy type exercises with 5 to 10 pounds, which is an appropriate amount of resistance. And then they try to get into the hypertrophy part of things, and they're now trying to do these what are designed to be small muscle exercises, and then they're just adding on pounds so that they can actually feel a pump. And again, you're mixing up goals. If you're working on muscle hypertrophy, you're not probably working on the muscles that are actually intended. to stabilize the joint. You're trying to work the smaller muscles, and when you add too much resistance, too much weight, you end up recruiting all the muscles, and that's really, again, not really the goal. Now, the last exercise class is pretty much recreational, and this is just any type of activity that's for fun. No real goals, just fun. So, this is, again, something that everybody wants to get back to, and this is kind of the pie in the sky when you've had a pretty bad injury, where you don't have to think about anything except just having fun. So I do try to at least get a sense from people, what do they like to do in terms of recreational exercise, even early on, because it kind of gives me an idea of where they want to go and what kind of activities they like to do, even understanding their previous athletic achievements. I think that's really very important when you're trying to take care of somebody, is to understand them on a deeper level, so that you can help them hit their goals. I find that when I do explain what is the goal of these exercises in their rehabilitation program, it does make a big difference, because I think it can be just very overwhelming to think about, how am I supposed to get back to my previous level when I feel all this stuff and I still can't do X, Y, and Z. I think it just overloads people. So again, just to kind of recap, the way that I characterize exercise are these three different subtypes: therapeutic exercise, goal-based exercises, example, skill acquisition, improving cardiovascular health, large muscle hypertrophy, and then finally recreational exercise, where you're just having fun with no goals. I encourage you guys to think about, what does exercise mean for you? If it means only one thing and it only feels one way, I really encourage you to start to try and think deeper about what exercise means to you, and if there are in fact other forms of exercise that you would benefit from. Thanks for listening. Take care. Thank you for listening to the Talking Rehab Podcast. I hope that this podcast stimulates you to question your own practice and how you approach rehabilitation. I truly appreciate your time and attention. If you enjoyed listening, make sure to like and subscribe to the podcast. I wish you a movement-filled day. Take care.